Welcome, everyone, to another edition of the Sports Medicine Update, a weekly podcast by yours truly, Jerry Riles, and, of course, the good doctor, Dr. Chad Prodromos. Looking forward to getting some more information, some helpful information, and just some insightful information today, a little bit better. Your athletic activities just a little bit stronger, more fun, exciting, and, of course, safe. Doc, how are you?
I'm terrific, Jerry. How you doing?
I'm doing fantastic. Dr. Chad Prodromos, President, Illinois Sports Medicine and Orthopedic Centers, Medical Director of the Foundation for Orthopedics and Regenerative Medicine. That's a 501c3 Illinois not-for-profit corporation. He's also the editor-in-chief, the Anterior Cruciate Ligament Basic Science and Reconstruction. Dr. Chad Prodromos, man, it's been quite an adventurous week as far as the sports world is concerned, not only for the local amateur person, you know, the guy, the weekend warrior out there, but also for the professional athletes as we hear the latest news as far as Major League Baseball is concerned. There's baseball in the air. The players will be reporting to their respective teams July 1st. And, of course, we're expecting to see some baseball July 23rd, July 24th. No fans in the stands, no question about it, and a lot of health and safety protocol plans put into place. But, Doc, I guess it's a breath of fresh air for sports fans to hopefully finally get an opportunity to see some live sports action. The favorite pastime, Major League Baseball. What's your thoughts on returning back to the sport?
I think it's all good. And as we touched on last week, the fans in the stands is the most problematic aspect of this. Mm-hmm. And if you just deal with the athletes, the support personnel, and get through that, and maybe everybody, gets through the jitters a little bit. We get things going. Absolutely the right thing to do on so many fronts. People need sports is kind of a happy place for people, something to be a diversion. And so, I think it's good for the health of the populace. I think that, and I think it's going to go fine.
No, I think it's going to go fine as well. And I do want to let our viewers and our listeners who are tuning in, maybe for the first time, on the Sports Medicine Update, the weekly podcast with Dr. Chad Prodromos. This is our 4th episode, and they'll certainly get an opportunity to check out the YouTube page or just Google Sports Medicine Update for the previous episodes if you want to get any information regarding sports injuries and, how to prevent them and, of course, how to care for them if you unfortunately sustain some type of injury that way. And again, in a nutshell, doctor, for those who may not be familiar with your work, just, shed a little light on, what you do.
I'm an orthopedic surgeon. I was fellowship trained in sports medicine 30 plus years ago at Harvard Med School, Massachusetts General Hospital. And for most of the earliest part of my career, that's mostly what I did. I became very interested in what we call regenerative medicine, stem cell work, platelet-rich plasma, evidence-based, and it has expanded my practice horizon because that kind of work is very helpful to older people with degenerative problems, for example, arthritis, autoimmune disease, as well as young athletes. So at this point in my career, as you mentioned, I'm editor of a textbook on the ACL, so I specialize in fixing anterior cruciate ligaments. I do mostly knee and shoulder surgery, rotator cuff repairs in the shoulder. Although, is kind of a sign of what I'm talking about. We are just getting set to send off a paper that I'm very excited about from our research foundation for publication, where we use platelet-rich plasma, which we talked about a little last week, taking growth factors from your blood, to address an area of damage to the shoulder that is not so amenable to surgery, which is partial tears of the rotator cuff. And we have a series of 60, 70 patients that we're reporting who had very good results. None of them needed surgery. So it's kind of an amalgam. I do surgery where I need to, although I try never to do surgery unless I have to. But more and more, I'm spending time platelet-rich plasma, stem cells. I'm holistically oriented, try to avoid drugs. We use nutritional supplements, let the body heal itself. So this has allowed us, and me in particular to treat a much broader range of injuries and for all kinds of people, including professional athletes.
Very well said, Doctor. So back to baseball. There have already been some teams and some players who have tested positive for COVID-19. There's some language put into place that said that if a player tests positive for the COVID, that they will be placed on the IL, the injured list, and there is no particular designated time as far as though they can be on that list or not. There are other language that says the player, if they feel uncomfortable, that they can opt out of this season due to the risk of contracting the COVID-19. I may be in a minority here, but I'm happy. Don't get me wrong. I'm happy that we're trying to get back to some normalcy as far as professional sports are concerned and getting the players back on the field. But I think I'm in a minority when I say that I'm still a little leery about starting because, the virus hasn't gone away and it's not going away. And we know that there are teams and players who have come down with it. And I still have in the back of my mind, Doc, the second phase. And it might be a lot worse than the first phase. And so I would hate to see the game get underway in the hopes of everyone, rise so high, only to see that it may have to shut down before we get to 60 games. What are your thoughts on that?
I'm a little more glasses half full. I think there'll probably be more cases, but I think it's going to be much better because we are in many ways much better equipped to deal with it. The biggest thing is that we know now, and some people figured this out earlier than others, is that there's just huge differences in at-risk populations. And the most productive thing that you can do is shield the people who are at risk. And actually, there's the whole concept of herd immunity, right, where it depends upon how close proximity people are, but if some percentage of the population, 50%, 70%, get infected and don't get real sick, then it greatly slows the spread of the virus. So I think that having young, healthy people get it more, the overwhelming majority of whom don't get very sick or don't get sick at all, is actually a benefit. But we just have to do a much better job going forward, and we will now, in shielding people who are older. And the argument goes that, well, if young people get it, it's not bad for them, but it's bad for the older people they infect, and right, that's true. But that is something that's also controllable. And there are other factors that lead me to think this is going to be better, several other factors, some substantiated, some not so much. There are reports from a number of places, actually Italy notably, where people feel that the virus is losing strength, that it just isn't as bad severity of illness-wise as it was. Another point is, what is the real death rate? Originally, people thought it might be 3 or 4%, where the flu is 0.1%. And we are finding out that the death rate is much lower than we think, maybe not much higher at all, maybe not higher at all than the flu, but certainly low. We have learned more, and what I'm about to tell you, I think, is not talked about enough. People talk a lot about a vaccine, and it's looked upon as kind of the panacea and the thing we're going to look at. And I don't know, vaccines are kind of tricky. But aside from the vaccine, we are much better now at treating people who are sick. It's become clear that being on a respirator, the criteria are different for COVID-19 patients. And being on a respirator is bad, associated with a greater than 80% mortality. So people are using respirators much less. And then the other thing is medications to treat it. So, there are, it causes its damage because of an exaggerated immune response. So there are drugs now. Remdesivir has been shown to help a little. Actemra, tocilizumab has been shown to help. An amazing finding is that regular steroids, corticosteroids that are used to fight inflammation, appear to be very effective. Hydroxychloroquine is controversial. We are publishing a large paper which actually examined the cardiac toxicity and found that it's not bad at all. In fact, it's cardioprotective in many ways. Now, that's a separate issue from is it effective? And we don't know if it's effective. There have been studies both ways. But the thing is, it's a mild anti-inflammatory. And I think we're going to find, and we're finding reports, there are many drugs that are out there that people are finding seem to help. So I think the other part of it is that if you do get sick, your chances, because our treatment choices are better informed, your chances of getting really sick are much less. So I think that I think there's virtue in trusting your fellow citizen some to do the right thing. I think most people do social distance. I think most people do wear masks. Right. It's easy to point to shots of irresponsible people who don't, but in places where lockdowns haven't occurred, most people have. So, I think that getting on with life, being cautious, and another point that I think is extremely important to focus on is that the number of cases is really, we have to keep track of it, right, but it's not the most important statistic. And you know this, it's more the death rate, the hospitalization rate. So I think it's important. Everybody knows that the lockdown consequences, economic consequences, there have been studies out of Australia that estimated that suicide could be a bigger problem than deaths from this. So what I'm saying is, I think forging ahead and not turning tail at the first sign that there may be a little something happening is good. And I think we're going to do well.
Well, I hope you're right. And I'm praying that you're right. But there's still, skeptics out there. And again, you talk about the numbers going down and not as many cases. And some people attribute it as, the warmer weather, the virus, as you talked about with Italy, kind of starts to die down and slow down. But what we've been hearing over the course of this pandemic over the past few weeks and months is that flu season. And when the temperatures, again, drop, that we're going to see a rise in the cases of COVID-19 across the board.
Well, that's true. And let me just say, the distinction to make, though, if the cases go way up, we have to worry. But right. The cases, I just don't think, are the most important parameter. I think we have to look at what happens to the people who do get sick. And bear in mind that, there's a good chance we're not going to have a vaccine. And if we do have a vaccine, who knows how well it's going to work, that sort of thing. Right. So, I think that the herd immunity concept, if you can do it without having significant mortality, is a silver lining in these cases occurring in a population that's less at risk.
So here's kind of the major concern with baseball returning. Again, it's the Sports Medicine Update, the weekly podcast with Dr. Chad Prodromos, our 4th episode here. Doc, the big question is, some states, as you well know, are allowing fans or allowing people to come back. Illinois here is opening up the state, and we'll talk a little bit about the health club starting on Friday. But some towns with baseball teams already moving forward and already have moved forward. And I guess the question has come up, fans attending these Major League Baseball games. We know what the criteria is for these professional athletes and the immediate staff. But let's say where you are down in Naples, Florida, the Florida Marlins or the Tampa Bay Rays allow fans in the stands, albeit, 50, 100, 1,000, 2,000, or whatever the numbers may be, and spread throughout the course. And as well as I do, fans are going to be fans, and you might get just one crazy fan who may, and I know they're probably going to do the temperature and everything, but that's a big risk factor, I think, and you just never know. Is that a concern regarding bringing fans to the ball game to watch their favorite players or favorite team?
Obviously, we have to be careful, but you bring up Florida. Florida was unusual in having their beaches open very early. And kind of like what's going on in Illinois, they said keep moving. But Jacksonville, for example, and Florida, overall death rate wise, has done well with a philosophy that has protected the most at risk. They were one of the few that really protected people in nursing homes early on. As we all know, there were states where well-meaning politicians, didn't do that. So Florida has done well, letting people, giving people a little responsibility. There is the super spreader concept also. So, so choirs, singing is kind of a bad thing. You breathe deeply, you exhale forcefully, you get a lot of people in a closed space, and there are so-called super spreaders that can occur there. I don't know that baseball fans sitting in the seats is that same kind of thing, particularly if you have masks on. And if people are told they need to wear masks, I think if an occasional person doesn't wear a mask, I don't think it's the end of the world. I'm not a big fan of the culture where we're encouraging people to report their neighbors to the police because there's not a mask, because it doesn't have to be everybody. It just needs to be most people. And the thing of it is, what I have seen is, I think people, there are some people who aren't, but the overwhelming majority of people that I see are paranoid about this in a good way. And so I think with the fans in the stands, if people are wearing masks, I think that they're going to do well. It's also warm weather where the virus gets killed more. So I think it's going to be okay.
Well, I hope you're right. As of this podcast, Doc, I'm sure you've seen the numbers and seen some reported newscasts across the board. But the numbers in Florida, they're doubling and tripling as we speak with positive cases of COVID-19. And so that's why I raised the question with the possibility of fans having the opportunity to attend baseball games. Who knows what the numbers are going to look like and what the cases are going to look like when we get really underway in mid-July. But it is definitely a concern. And like I said, I want to be optimistic about the return of the game. And we need something. To get our minds off of this, whether it's be for 2.5, 3 hours, 4 hours, and baseball certainly can add that. But the reality aspect of it is, allowing fans in some of the stands at some of these games, it could pose a problem. I'll give you an example why I say that. Just today, I was outside talking with my neighbor, and he unfortunately didn't have his mask on, and he turned away to sneeze. And when he sneezed toward his grass, and I could see the droplets, the projectiles, shooting out from his mouth and his nose. Some, I say more than, it could be about 6 feet, but those were just the spray, the droplets that I saw. Now, how far it traveled after that, I have no idea, and it's been reported that it could go up to 14 feet. So you got fans in the stands, and I'm sure you're going to, like I said, fans are fans, and you may have a fan that don't have the mask on, and, maybe, just maybe, something like that happens. And so that's why I'm kind of skeptical. And like you said, I guess the term to use, paranoid in a positive way. I hope that we can get through this and turn the curve. But as far as the numbers in Florida are concerned right now, seems to be tipping in the other direction.
Well, you see, but the other way to look at this is that the more the case numbers go up and the more the death rate stays low, the more the death rate approaches the flu. And people die from the flu, Right. And right. But if there's and any death is a horrible thing, obviously. But you're not going to prevent everyone. And I think the measures that try to prevent everyone has unintended consequences that are worse. Also with regarding your friend outside. So, we found that spread is much more occurs when people are cooped up indoors, much less outside. So those droplets might spread. They do spread some, but they tend to head downward. They don't survive very long in the sun. It's been shown that they don't survive very much at all. We know now that spread through surfaces is kind of, less than we thought. So I just think that that as the death rate stays low and the case rate goes up, it has a silver lining in herd immunity, and it makes us realize that it's maybe not that deadly, as it was originally thought it was. And I think if something occasionally bad happens, that's terrible. But bad things happen from a number of sources. Right. So, and again, the outdoor environment is far and away, outdoor environment in the sun. Most baseball stadiums are outdoors, is probably is the best place to stay safe from this.
Well, let's hope that is the case, and let's hope 2020, Doc, we can name a World Series champion, and maybe they come from the south side or the north side, but let it come from Chicago.
Yeah, that would be just awesome.
Talking about getting back to regular normal activity, whether you're professional ranks or the weekend warrior amateur guy, or a collegiate person trying to stay in shape. Gyms across the state of Illinois are planning on opening, or at this podcast are opened and going to the next step, the next phase. How do you protect yourself from your regular health club, whether it's LA Fitness or the area Park District Gym or whatever? How do you protect yourself moving forward?
So I think masks are good. And I know that a lot of people don't like masks, but so in my line of work, spent an awful lot of hours in my adult life wearing a mask in the operating room. Mm-hmm. And you kind of get used to them. I think it's, important to maybe find one that's comfortable for you. I use one like I wear in surgery. It's not an ND95, but it ties in the top and the bottom rather than being around my ears. And I have it on all day seeing patients, and I honestly forget I have it on. And there's different varieties. The ND95s are a little harder. Maybe I'm not sure that you need that level of protection. There are the hard ones or ones around your ears. But I think the masks are really important. Mm-hmm. And so surfaces are important too. Another thing that is talked about, but maybe not enough, is just not touching your face. The reality is if you happen to get something on your hands, and of course you should wash your hands, and I do. But if you just get in the habit of just not touching your face, it dramatically lowers the risk. So, I think wear a mask, wash your hands, don't touch your face. And, there's some really interesting research, and I don't have the acronym right at my hands, but there was a great article where a doctor found that muscles secrete a protein that mitigates COVID-19. So this kind of goes along with data from 100 years ago from the so-called Spanish flu, that exercise seems beneficial. Building muscle seems beneficial. So there's an upside to being outside. We already know about that. But to going in and pumping a little iron and building those muscles, it can objectively make you healthier where this disease is concerned.
That's interesting that you say that. And as far as touching your face is concerned, I don't have the numbers as accurate, but I understand on an average day, the average person touches their face at least, I may be a little bit high on this, but it could be between 2,000, 3,000 times a day, Doc. Does that sound where you're touching your face and don't even realize it?
Well, I'll tell you something, I'm sure if somebody observed that it's probably true. But I'll tell you, for professional reasons too, because, again, in the business that I'm in, aside from COVID-19, you kind of have to assume that everybody you see has some communicable disease that you wouldn't want to get, whether it's hepatitis or HIV or whatever. So I mean, I will tell you that I touch my face almost never, almost never. Wow. And I think you can train yourself to do that, and it's just a habit.
Right. It's a bad habit, because my daughter tells me, she goes, "Dad, you touched your face, wash your hands." I go, "But I wash my hands." She goes, "But you touched your face, so you got to go wash your hands." I go, "Okay, I got to go wash my hands."
No, sorry.
No, go ahead.
Well, back when I was in high school, so you're in high school and teenagers break out and get acne and whatnot. And I remember it was kind of dogma. There's a lot of stupid stuff. I don't eat chocolate. I don't know if that matters. But I remember one of the dogmas was not to touch your face, because the thought was that you have oil and you have bacteria, So teenagers are vain and body conscious. So I remember back then, it would, talk about it a little bit. So, but yeah, I think you can train yourself.
Yeah, I think you can too. It's a tough habit to break. But and as they say, we're creatures of habit. So it's just a matter of changing your habits. That's for sure. Dr. Chad Prodromos, Sports Medicine Update, the weekly podcast, episode number 4. So the Weekend Warrior. I got a membership to the Park District to go work out in the gym and everything. I'm ready to get in there. But Doc, I mean, if Joe or John Doe just left and they're sweating like buckets, because I understand that you're not allowed to shower in certain places as far as gyms are concerned. They're going to have the social distancing as far as lockers are concerned. Every 6 locker you'll be able to use. They're supposed to be wiping everything down as far as the equipment is concerned. But as you well know, some people, the old saying is that women don't sweat, they perspire, or something like that. And some women believe they don't, sweat. But people, guys and girls, sweat at a different rate. How do you balance that? One, being the staff that's working in those facilities, and of course, the everyday person who's coming back to normalcy as far as working out is concerned, to make sure they try to keep the numbers down.
Yeah, well, it's kind of like what I said before. The respiratory aspect of it is just so much more important than everything else. Wearing a mask, and you can wear a mask and work out when we're outside. So we cycle, we don't. But you can, and if you're in a gym and you're on a bike or an elliptical, you should. I think, again, it's kind of like what I said. If I get something, and again, it's kind of a medical thing, because, we're conditioned to breaks in the skin, particularly with hepatitis and HIV and all that. When these things came, that, you don't want to have a break in the skin, because the skin is a great barrier. So, I'm just not as concerned with getting things on my hands, as long as I'm never touching my face, and then if you wear a mask, I think what you said about lockers, I mean, it's been for decades now, people have been showering less where they exercise for a variety of reasons. I mean, my old high school, we all took a shower after gym, and those showers have had cobwebs for decades now. So, right. Yeah, I think, go to a gym, sweat, go home, wipe things down. And I think it'll, check people's temperatures. We do that in our office with everybody that comes in. And that's a place where I think you should mandate that people wear a mask, like on an airplane. And I think if you sweat, I don't know. I just don't think that I just don't think it's as big a problem if you're not touching your face. And the health benefits of exercise are so great. The other thing about it too is I'm kind of a big believer with exercise that, if you're going to do it, I think strength training in a way where you're really trying to build muscle mass or trying to avoid losing muscle mass. Don't do it every day. You mentioned the Weekend Warrior because you're going to hurt yourself, but your body needs recovery. But go in seriously twice a week, maybe 3 times a week, lift weights, try to build muscle mass, because as I said, that has health that has health benefits, and you can do a lot of good in a short period of time. Ditto cardio. I was just talking to a patient of mine, a friend of mine, who got an elliptical and who stays on it for a long time. And I'm kind of more of a believer in stay on it for a shorter time, but get your heart rate up way high, unless you have heart issues. And I think you get more health benefits out of it. It also kind of decreases the burden on the gyms, too, of the amount of time that you're spending there.
No, it makes sense, Doc. And, again, hopefully we're moving to the next phase. And here in Illinois, it looks like everyone is staying the course. And we're trying to get to the next level where we can get out and get the in-house dining as opposed to, the outside dining. And, of course, getting back to the gyms and working out. And as we touched on in this podcast, the opportunity to watch some professional sports being played, that's starting with baseball, and we'll see what happens with football. That's from a media perspective, that's the scary thing as far as, the public is concerned, is that these professional athletes are starting to test widely for this coronavirus. We know that the Dallas Cowboys, Ezekiel Elliott, tested positive. Yet down in Florida and Tampa, Tom Brady is still working out with a few of his teammates at a local park, and they seem to be, safe and healthy. And I don't know if they're practicing social distancing because they don't look like it. But that's another stickler, and that's another question mark, because I know college sports are kind of slowly trying to transition as well. But it's the fact that with football, because of the physical contact and because of all the equipment and because of all the droplets and the liquid, the sweat and everything, that's a higher risk, it appears. And it also appears that it'll be tougher to police, so to speak, as opposed to the other sports.
Yeah, you're absolutely right. And, one other thing that I just wanted to mention one more time that I touched on before, the issue about people going to games and maybe there's some risk. As I said, if there's an occasional case or even an occasional death, that's a terrible thing. But, it's been well documented now that we talked about physical health and working out, but the mental health aspect of being cooped up, of being, some people have said that with the recent things that have been going on in the streets, that people are more miserable even than they might otherwise be because they've been cooped up for so long. It increases anxiety, suicides, domestic abuse, all that. So, there's a definite mental health upside to this that I think is, can't be ignored when we're worried about the number of upper respiratory cases.
Yeah, I mean, that's exactly right, because everyone's focusing, and I think, not to get into political issues or anything like that, but with the social ramifications that we witnessed regarding the riots and all the protests and everything going on, I don't know if it's a lot of it, but I believe a good portion of that was like what you said, the anxiety and the state of depression from being cooped up for 12, 13 weeks. And of course, with the weather turning better, I think one thing led to another, and people just, they just let it all out, so to speak. And that's something that has not been featured or highlighted or discussed much. But it's the mental state of everyone being locked up and, wanting to be outside because, like we discussed, creatures of habit. And we know we have to stay in for, it's cabin fever, the winter, and we're getting tired of it. Then, of course, with the rain in the spring, people were just, accustomed, hey, we're ready to get out there. And now having to be cooped up, it really raised the level of anxiety and depression. And we see what the aftermath is. So maybe that's something that we can touch on, moving forward, because I know there are a lot of people out there, Doc, that need some type of, we all may need some type of therapy. And I'm sure you've seen on the television the commercial Calm, where they have the rain coming down for like 15 seconds or 30 seconds. And it said Calm, and then says download, this app, because people need some type of therapeutic, resolve, some type of therapeutic solution to try to get through this.
Yeah, and and good point. And another related point there too is comorbidities. So obesity has been shown to be a huge comorbidity. And I think I mentioned in our first podcast that I had this nice lady that I take care of who swam to control her weight. She gained 30 pounds, you know? And so people that get heavier are likelier to do worse. So, you know, is there a little risk maybe to getting back to the gym and doing some of these things? I suppose, but there's great risk and you know, especially in young people. A lot of the young people that have had issues have been kind of heavy. So, and exercise is extremely important to control people's weight. It's, you know, it's extremely important to control people's mood. I tell patients, as I've mentioned, I'm kind of pharmacophobic. I start from the perspective that all drugs are bad, but there's some where the good outweighs the bad and you have to use them. But the proliferation of antidepressant drugs in our society is staggering. And I tell people, you know, that exercise is, if you will, God's antidepressant. And it's used, you know, the Chris Mullin's case was well chronicled, who had some issues and exercised like crazy, got his heart rate up, and you make endorphins, you know, by exercising in a way that's much better and more natural than medications and without side effects. So there again, you know, it's worth maybe a little risk to be able for people to get to be active for that reason too.
Mm-hmm. That's exactly right. You just feel good after working out. It's a good workout.
Right.
You dread it, thinking up to it and leading up to it. You dread it, but once you're done, you see the results and you feel the results. It's rewarding, and you want to get right back out there again. Hey, Doc, thank you so very much. I'm looking forward to the next episode and the previous episodes. We have an opportunity. We can go back and revisit that. But thank you so very much. Again, if people want to get a hold of Dr. Chad Prodromos, our sports medicine update guru, specialist, expert, how do they get in contact with you, Doc?
So our main number is 847-699-6810. There's an email just to ortho at ISMOC, that's Illinois Sports Medicine and Orthopedic Center.net, and you can just find us online at ismoc.net.
Sounds good, Doc. Thank you so very much for the information. Very, very valuable, also knowledgeable. You bring it to the table every single time, and we look forward to getting more of your knowledge moving forward. Thank you so very much. Stay safe and enjoy your stay down in Florida.
Thanks so much, Jerry. My pleasure as always.
Dr. Chad Prodromos. Take care.